Hello, everyone. Welcome. We will give everyone a few minutes to get in, get settled before we get started. All right. It is 2 minutes after the hour, so let's go ahead and dive in. I'd like to welcome you to Health Equity in Action, Libraries, Communities, Opportunities, a summit hosted by the American Library Association Social Responsibilities Roundtable, or SRRT. SRRT believes that libraries and librarians must center social responsibility by recognizing and helping to solve social problems and inequities to work for the common good. My name is Taylor Atkinson, and I will be your moderator for this session. I'm joined by Alicia, who is overseeing the chat, and Hillary, who is monitoring the tech. To enable captions, click More in the bottom right of your screen and then click Show Captions. Our session today will be recorded, and the recording will be available on our website within a few weeks. This session focuses on strengthening training and awareness to better serve all community members. We are joined by 7 amazing presenters. First, we have Leah Topek-Walker and Margaret Paauw, who will be discussing library social work partnerships. Then we will have Kendra Cowley, Margaret Sullivan, and Sane O presenting Our Patrons Aren't the Problem, Library Workers and the Toxic Drug Crisis. And last but certainly not least, we have Dr. Renate Chancellor and Christopher Stewart presenting Make Me Wanna Holla, Libraries, the Unhoused, and Mental Health Justice in Public Spaces. We'll ask each of our presenters to tell you a little bit more about themselves, but for our participants, full bios for each of our presenters are available on our website. We will be taking questions for our panelists after all 3 of their presentations. So please use the Q&A feature to pose your questions. You can do this at any time throughout any of our presentations. We ask you to please reserve the chat to relay any tech issues, for resource shares, or appreciation for our panelists. And let's get started. So without further ado, I will turn things over to Leah Topek-Walker and Margaret Paauw to begin their presentation on library social work partnerships.
Oh, shoot. Okay, how are we looking? Can everyone see this? Hear me?
Yeah.
Everything. Fantastic. Great. Uh, Well, welcome everyone. Thank you all for being here today. We're excited for this opportunity to speak at the Social Responsibilities Roundtable and the Health Equity Summit. I'm Margaret Ann Paauw, and my colleague and I will be, my colleague, Dr. Leah Topek-Walker, and I will be discussing library social work partnerships, what library social work looks like across the country, and then just some kind of information on how we got our program started and up and running, and some examples of, yeah, what it looks like across the US. So again, I am Margaret Ann Paauw. I'm an assistant professor at Eastern Michigan University. I'm also a licensed clinical social worker. My practice background has mainly been working with individuals with serious and persistent mental illness and or experiencing housing insecurity as well. I was the one of two library social workers at the Chicago Public Library for approximately 3 years, mainly during the pandemic. So it was a bit of a wild ride there. I also co-authored Trauma-Informed Framework for Supporting Patrons and then authored Navigating Difficult Situations in Public Libraries. So some of the stuff we'll talk about today kind of has some crossover there. Feel free to check out those resources. And then my main research area is in library social work. My dissertation was the first nationwide mixed method study on what library social work practice looks like across the United States.
And hi, everyone. I'm Leah Topek-Walker, and I also am a licensed clinical social worker, and I'm also a clinical associate professor at Stony Brook University. We have the largest library social work internship programs in the US. This year, we're partnering with 30 public libraries across Long Island, New York. And so most of my research has been around some security collaborations with and trauma-informed de-escalation with public libraries and supervising my, as I like to call them, my small army of social work interns that are trying to change the world.
All right, thanks, Leah.
Okay.
Okay, so I think I can do it, Leah.
You can do it. Yeah.
Leah and I present at a lot of conferences and do a lot of this stuff together. So, yeah. Our learning objectives for today, as I kind of mentioned on the first slide, we're just going to provide information about what library social work partnerships look like and then how they can be leveraged and within the context of the roundtable today, specifically looking at health equity. So we have some kind of examples of what library social workers are doing surrounding health equity, improving community health and wellness for patrons and for library staff. Our other objective is to just understand the various approaches that social workers utilize to assist patrons in accessing and navigating community resources. So some of the things, yeah, we kind of do a lot of different stuff in libraries, and a lot of them, again, intersect with health equity. And then lastly, we'll talk a little bit about how to kind of develop and implement these partnerships and programs and give our library social work partnerships. Leah's in Long Island in her army of social work student interns, and then some of the partnerships that I've helped develop out here in Michigan and then in Illinois.
Um, so you might be wondering, or maybe you're not wondering because you're all in this roundtable, but how, like, why do we need social workers in libraries? And we know that, and as social workers, we know that most of the folks that we work with have encountered many barriers when they're trying to access basic human rights and resources. So some of these barriers might include having to provide detailed demographic information, especially in our climate now. Many people are quite fearful and have every right to be quite fearful about providing information to different sources. There's also a lot of criteria, rigid criteria around qualifying for services. So we have lots of folks that do not qualify for services because they're a few dollars over the income threshold, or they don't have a severe enough diagnosis or things like that. There's also just some very stringent eligibility requirements for different services that um, kind of that weed out a lot of people from qualifying for them. Long wait lists. People can be on a housing wait list for 8 to 10 years sometimes. Fear of the systems. People have lots of trauma with lots of different systems that we work with, and they might have a lot of fears around, what it would be like to interact with those different systems. Some of our services and our service providers have specific catchment areas. So if someone lives outside of that area, they cannot get the service that they might need. Lengthy and invasive intakes. If anyone has ever gone to Department of Social Services or to an agency to try to access services, and they've had to ask about 15 pages of questions just to help someone get food for the day or a bed for the night, that can be a real deterrent. And then sanctions. People can get sanctioned by especially the Department of Social Services for a variety of reasons, but then it doesn't allow them to get services. So we have folks here on Long Island that get sanctioned and cannot get housing, no matter if it's the only time it's lifted is if it's what we call code blue. So if it's below freezing. So if it's 35 degrees and they're sanctioned, they're not eligible for housing for the night. Even if they're living on a park bench or in an encampment, they still are not allowed to access services. So we have all of these barriers that have that are kind of in place, and that make it really hard for people to get services. And a lot of those folks end up at our public libraries because, as you know, libraries are amazing community third spaces that are free and accessible. And so now we're here. So, kind of in a nutshell, right? Like we break down barriers as library social workers. And, one of the things that we always talk about is that so people come in and we'll help them no matter what. So someone can say, "Do I need to tell you my name?" And we'll say, "No, not unless you want to. Just tell me how I can help you." And that is kind of the opposite of how many other social work services are provided and many other public services are provided. People have to provide a litany of information, like I just said, in order to even get to find out if they're eligible for help. And instead, they come to the library and, there's no barrier. We want to help you in any way we can, and we don't need anything from you to do that.
And I think like yeah, this is kind of the true spirit of library social work too, is just really low barrier. It's an incredible setting to work in. Leigh and I both have, kind of long social work careers before kind of teaching and um, doing research. And yeah, we've had to work within these systems a lot. And like working in public libraries has just been like an incredible way to like make the movement, that we've been wanting to make in that we weren't able to necessarily in the capacity of other social service agencies. So yeah.
Yeah.
Okay, so that all said, what do we do then? What even is library social work? What kind of tasks do we engage in? What type of things can we help with? So in social work, we kind of have these three buckets of areas of what practice looks like. We have micro practice, which focuses on kind of more individual work. And then we have group practice. We also have meso and macro practice, which looks at breaking down kind of systemic barriers. So this can look like group practice as well, but it can also look like hosting community workshops, hosting facilitating training, doing community needs assessment, advocating at the local and state level for certain policies that affect our patrons and our community members. So backing up just a little bit, let's talk about micro practice. Um, this looks like really individual patron work, a lot of resource navigation. So sitting down with patrons and just directing them to specific resources that are available in the community. Um, Part of one of the barriers to receiving care is just like not knowing what all is out there because some areas are very resource rich and some areas are not, but our job is to know about what available resources exist in the community and then connect people to those. So linking individuals to care, including food, housing, employment, legal, certainly medical and mental health as well, right? We're not necessarily like practicing mental health or anything medical or anything like that in the library, right? But we're that point person to help make a referral and make sure that people are getting the care that they need. Um, we certainly assist individuals with applications. When I was a social worker at Chicago Public Library, I did a lot of Medicaid, SNAP applications. I helped individuals get connected with Medicare. I'm not like picking plans for anyone, but I'm helping like, okay, these are your available options. This is who you can go to like get kind of more questions answered. But yeah, certainly a lot of assistance with applications too, and which is essentially a form of brief case management. Um, Crisis intervention is also something that we do in public libraries. A lot of times, public librarians aren't trained in navigating crises, but they certainly arise in public libraries. So, kind of bringing in our social work background and expertise into these spaces and helping get people, kind of de-escalated back to baseline and then follow up with services. Anything about micro practice you want to add, Leah?
Um, just that, the digital access, it's really, we know that there's a huge digital divide and that folks either don't know how to use digital technologies or they don't have access to them or both. So, and we also know that lots of those folks are in the public libraries and need so much help and ask librarians to help them with, everything from figuring out how to get into like their email, passwords, etc. Social workers and social work students can do all of that. And they can, while they're helping with just like the kind of concrete, like how to get into your email or how to make a password, also assist with filling out online applications, which for many of our social service providers is the only way to get access to those services right now. So they really bridge a huge gap and a huge need in the community when it comes to digital services.
Yeah, and I remember even like during the pandemic and then a little bit after too, like helping people. There was several like internet providers where if you showed that you were on Medicaid, you could get significantly discounted internet access. So they had these like Wi-Fi, kind of pucks or whatever that they would give out to people. So yeah, we would do a lot of that stuff too. Yeah, so
Mhm. Yeah.
thank you, Leah.
Yeah.
For group practice, this basically looks like I mean, can look like co-facilitating or facilitating support groups for people in recovery, for caregivers who are experiencing compassion fatigue, for teenagers. I have a few students who have done like a variety of different programming directed specifically at teens and young adults, parenting. Currently, one of my libraries is partnering with like a parenting group that's doing supportive kind of group work, but then also community workshops as well. And these can also look like housing, immigration, et cetera, Narcan training. We've had uh, kind of like harm reduction community organizations come in and give Narcan training. We've had like know your rights, immigration, legal kind of groups come in and help out with those communities and provide workshops. And not even like recent, like certainly recently, but this was even, you know, 7 years ago or so, we were providing those because ICE was really big, and in Chicago being a sanctuary city, we were often targeted even, you know, long before what's been going on recently. Um, Anything else to add here, Leah?
And no, I mean, and usually our approach with any kind of group and any kind of service is that it really depends on what the community needs. So I've had social work
Yeah.
interns in a library that has a big teen population. It's next to a school. The after school hours are, kind of bananas. So that social work student has run multiple different teen programs. And they get creative, so they do crafting with teenagers. They do, one of my students did bubble tea, which when it was a big fad. And
That's
then
fun.
yeah, it was really cool. And so, so bringing in kind of different things, different modalities. And then other students I've had that are in libraries that have a big senior population, they're running like a senior coffee chat group in the morning. So it really just depends, on what's happening in the community, what the library needs. We had a very serious incident of child abuse with like someone local in one of our local communities, and the student brought in speakers about recognizing signs and symptoms of child abuse because the community felt like they needed something to kind of tether them after that event. So, we just try to be responsive, which I think is what libraries also do, right? We respond to the needs of the community. So the groups reflect what the community might be needing at the time. And then
Yeah.
do we want to talk about the meso and macro practice levels?
Yeah.
Okay. Yeah. So in terms of like meso, which is really community work, and then macro, which is more policy oriented work, library social workers can do a whole bunch of things. We co-facilitate staff trainings on different topics. So we've done trainings on trauma-informed principles and practices, on de-escalation, on library social work, on how to access DSS services, again, like what the community needs. And social workers can also provide consultation on policy and organizational practices, which is always really interesting to kind of look at the policies that exist within the system and evaluate them through a trauma-informed lens, and think about, for the staff who are implementing them and for the patrons on the receiving end, what is this looking like? Social workers can do needs assessment within the library or within the community to really identify what are the most pressing needs within the organization and in the larger context. They can also do community organizing and facilitate partnerships with different local organizations. So they can libraries already have so many great community partnerships, and social workers can deepen them or strengthen them, or maybe access other services that are not being used right now and kind of bring them in. And then also
We'll
advocate.
provide examples in just a minute of
Yeah.
what those kind of partnerships look like and what can come out of them.
Yes. Um, and then just some advocacy work. Social workers are always doing advocacy. So when we see a system that is working really well or not working really well, the library social worker can be involved in talking about what changes need to be made, how to enhance what is going well, advocating for things within the library or within the larger community context as well.
Yeah, and I just wanted to add one more thing around the needs assessment. So something I have my social work student interns do. Right now, I have 6 social work student interns across 3 library systems out here in Southeast Michigan. And something that I have them do as I'm like when we create these partnerships, and like the first social worker or social work student, for this whole library system, they've never had it before. Very first thing I have them do is a needs assessment. So what they'll do is they'll survey the staff, the library staff, and ask about what needs do you see here at the library, right? So some of the needs are like categorized by like child, adolescents, teenagers, and then adults. Um, so I have them kind of like go through and then like rank order a bunch of different, needs like housing, education, digital access, mental health, things like that, food, et cetera, et cetera. And then we compile all of those surveys and have data on, yeah, what the needs are broken down by age demographic. So it's helpful for us to get to know, as Leah was saying, every library system is different. Every community is different, meaning all of, their needs are different and look different. So what I'm doing at one library system out here might be completely different what I'm doing at a different one, right? Depending on the needs of that community and of that library specifically. So this kind of helps us start off like, okay, here are the needs. This is what this program then should target. And it's a fun exercise for students too, I have to say, because they get to collect data, they get to like kind of go through and do the research process, which is yeah, fun and exciting. Though I understand not everyone thinks research is fun and exciting, but I certainly do.
I do too.
Yes.
And I see Margaret Sullivan gave a shout out with her hand, so yes. So just some examples of health equity through library social work. So we do these community block parties that are the most fun and awesome events, and we do them about twice a year because they're also so much work. So this is the pictures from one of our events that we did last summer or in May, right before the end of the semester. So first we spend time, we try to invite every single community organization, community agency in the community to come and do tabling. So at this event, I think we had 10 agencies that were able to come in. It was in May and it was a beautiful day. So we, and the library had this amazing outdoor space. So the library had crafts and family fun and games and all sorts of just like really cool stuff for kids and families to do. And we collected so much food. This is not even all the food that we had, but we do a huge food distribution. And if you've ever gone to a food pantry, typically what happens is they ask you how many people are in your family, and you get a bag based on your family size. So we do this a little bit differently. We lay out all the food, we get a bunch of student volunteers, and we ask people, what can I help you collect? And people can take whatever they need. So there's and no questions asked. I tell my students the only question we ask is, can I get you another bag and can I help you carry that? So if someone needs one box of mac and cheese, cool. If they need 27 boxes, also cool. And we give out the food until it's gone. So we give out all this food, and then we also have the social work students available for consultation, for help. So people will come in and they'll be able to, play games, do crafts, access all of these different agencies that are also interacting with each other, get a bag or 5 bags of food, whatever the case might be. At our last block party that we did right before Christmas, we actually had a table of warm winter items. So we had blankets and we had hats and gloves, and it was like the best timing because then after we closed up for the day, that night there was a huge snowstorm, and we were all really just so thankful that we had given out those items that day because people we knew were really going to use them. So it's just so these block parties are just this like really amazing no barrier way. People can come to the library, access all of these agencies. Sometimes they can't get there in person for appointments because of transportation barriers and other barriers, but now they're all in the public library, totally accessible, getting food, playing games, and just enjoying the space and being in community with each other.
Yeah, thanks, Leah. That stuff is so cool. I love that. The block parties you do out there. And just like like you said, like the kind of like choice-based type pantry versus just giving a box and,
Yeah.
whether or not this is stuff that you're interested or like or eat that, here it is. So yeah, very cool.
Yeah.
Okay, so I'll give an example from some of the work that I've done, and then to be mindful of time, we'll kind of wrap up and talk about key ingredients to make sure we're hitting on all of our objectives here. So on the left, I have a picture of a food truck here. This is Fed Up Ministries that's in Ypsilanti, Michigan. So we're right outside of Ann Arbor here at one of our library social work programs. The library social worker there had a bunch of different community partnerships. One of those community partnerships was with this group, and they would come. I'm trying to remember, I think once a week or every other week or something like that, and they would provide free meals to patrons and individuals in the community. So that was cool. So yeah, there's like a lot of really cool like kind of mobile outreach that is happening across the country in various communities. But like something that we've done as social workers is like kind of connect and have like the library be a point for those as well. So on the right um, side of the screen here, this was both from Chicago, our Chicago Public Library program. So we had um, partnerships on the north side and the south side of Chicago. These two pictures were both taken in the Humboldt Park area, I believe, maybe one in like, yeah, further south on the south side of Chicago. But we partnered with like University of Illinois Chicago. They had like street medicine teams that would come out and they would do, kind of like basic primary care stuff or basic, consultation on like, okay, yeah, actually you should go to an emergency room or, here's how to, kind of like help out with whatever medical kind of concern that patrons would have. We also, for a hot minute, had like a dental van come too. It's really difficult to get dental care with Medicaid and individuals who are low income. And so we had like this dental van that would go around. I had known about it because of my previous position. This dental van would come to like our community mental health locations. So then I was like, why not the library, right? So yeah, there's a bunch of different ways again, like showing the kind of like health equity, like these health assessments and stuff like that can happen at public libraries, right? With partnerships with local community organizations or local uh, uh, health clinics as well. Okay.
And so I think we have maybe like less than 5 minutes. So we'll quickly talk about the key ingredients. And I just think to loop back for 1 second to the community partnership, that one of the things that make it so amazing at the library is that when you go to the library, there's no stigma, right? Like everyone goes to the library. So having all of those services related to health and, health supports at the library, it like destigmatizes them. So folks that maybe can't or are afraid to access them in other venues, they can. So it really just is like this equalizer for everyone. Um, and now I'll just kind of quickly transition to the key ingredients to these partnerships. So what we've discovered through years and years and years of working with different public libraries and not as librarians, but as social workers, is that there's a couple things that you really need to have in place to make these partnerships work. So one is open, clear, and accessible communication. As a social worker at a university running a program with like 30 public library partners, I need to be able to talk to everyone through email, through phone calls, making sure that communication is clear, that on my part, I'm upfront and really transparent about what the needs are of the students, the program, questions around like things like liability, all sorts of things that come up. We need to just really be able to talk and communicate clearly about them. Also, we need to have role clarity so that my students need to know, and if I have students that get hired through the library as social workers, they need to know what their jobs are, what they can do, what they absolutely cannot do, what's within their role, what's outside of their role, what is the librarian's role, right? We all need to be aware of what each other does so we can work together. Um, and for my student interns, they also need to know what is the role of their library task supervisor, and that person also needs to know what their job is, right? So they need to understand, how they give students assignments, how we talk about when they're making patron referrals, how they do that, how much they can know about patron referrals once they're made, because we do have to, maintain confidentiality. Lots of questions come up around different roles, so really being able to hash out, who's doing what is critical. And Margaret Ann, do you want to talk about the last one since I've just been talking a lot?
You're fine. I was just gonna say, like, Leah and I also have a lot of resources for this too.
Mhm.
Like, I know we just had the one slide that said, like, micro, meso, macro. This is like what kind of practice generally looks like. But one of our colleagues, Dr. Beth Waller, created a lot of incredible toolkits that are super, super accessible, free on her website. We're
Mhm.
happy to share those too. And those really talk about like what exactly the role is
Mhm.
between, yeah, the student, the social worker, if there is one. Often these programs, so like Leah's program specifically, like there isn't a social worker that's there. It's just student run. In my actually now two of my programs out here, we do have a library social worker there. So like that looks a little bit different, right? Like who's reporting to who and then who is doing what. But again, I just wanted to like kind of plug Dr. Waller's stuff, and we can
Yeah.
certainly share some resources around that too.
Mhm. Yes. And the last key ingredient is just the supervision and training and community involvement that library social workers they need supervision from other social workers, students definitely need supervision, but they need training, they need ongoing community involvement. And this is really critical because, you need a social worker in a library that knows what's going on in the community, knows where the community resources are, and is involved in that community. You don't want someone who sits behind a wall every day separate. You want someone who's out there and who's in it. And if you have student interns, you want them to be getting tons of training because as we all know, the library, anything can happen, right? So we can never predict who's coming in and what they need help with. So our students need as much training as possible.
Great. Well, thank you so much. And
Thank
thanks,
you.
Leah. Appreciate you guys, and I'm glad to be here.
Yes, thank you, everyone.
Thank you so, so much. Round of applause. Thank you for Dr. Leah Topek-Walker and Dr. Margaret Ann Paauw. That was fantastic. I know that I personally have several questions for y'all. And like Alicia said in the chat, please feel free to enter any questions for any of our presenters. We already have a couple. So I'm saving those for later. We'll get to all of our questions after all of our presentations. So thank you both again. That was really incredible. Next, we are going to move to Kendra Cowley, Margaret Sullivan, and Sane O, who are presenting Our Patrons Aren't the Problem, Library Workers, and the Toxic Drug Crisis. So I will turn it over to y'all. Thank you.
Okay, are you all able to see my presentation? Yeah, okay, awesome. So yeah, our session is titled Our Patrons Aren't the Problem, Library Workers and the Toxic Drug Supply Crisis. And we're gonna just do some introductions and context to start. Then I'm gonna talk a little bit about the language that I use in this presentation. I'm going to talk about drug use in the Canadian Public Library, and then I'm going to pass it off to my new collaborators, hopefully, Margaret and Zane, to talk about some surveys that they've done around information-seeking behaviors of people who use drugs at the library, an opioid toolkit for libraries, and then we're going to wrap it up with some what next sort of questions. So I think first we'll just introduce ourselves. Margaret and Zane, do you want to go first and just let folks know where you're coming from, who you are, and what you do?
Sure. Um, okay, I'll go first. So hello everyone. My name is Saint O. I'm an assistant professor of professional practice and information science field at Louisiana State University. Yeah, I'm really very pleased to be here today and to share my perspectives with you.
Okay. Hi, sorry, I'm Margaret Sullivan, and I was just looking, somebody asked for the slides to be larger. I was looking, if you go to the top left hand, right by like the little red and yellow and green dots, there's a little drop down, and then you go to Kendra's screen, and then from there you can make it larger, just for future use. I think that's a really helpful tool. Anyway, I'm sorry, I'm Margaret Sullivan. I'm an associate professor at Florida State University's School of Information. And my primary area of study is actually public libraries and the opioid crisis. Thank you.
Cool. And my name is Kendra Cowley. I use she, her pronouns, and I am, after a very weird turn of events, now the graduate research and engagement librarian at the University of Wyoming. However, up until this summer, I have worked in the Canadian public health or public library system for the last decade. In the last 5 years, I was working at the Toronto Public Library. And for folks who don't know, TPL is the largest urban library system in the world. We have 100 branches, and over 85% of the 3 million people in Toronto claim that they use the library, which is pretty rad. So I started there working inside Toronto detention centers as a librarian, and then working at one of our large district branches in Midtown Toronto. And then in 2024, I became an organizer with Library Workers for Supervised Consumption Sites, a group that has organized around the province in opposition to the closure of supervised consumption sites in our communities. And I'm going to talk a little bit more about that. So this is very much, it's actually, my part of this is a little bit more theoretical, but grounded in a deep, deep practice. So it's important for me to take just a few seconds to set up the conversation. Harm reduction work to me is deeply anti-colonial and rooted in Black and Indigenous struggles for self-determination. So I just want to start with a quick land acknowledgement. I'm clearly calling in from Wyoming, but this research is grounded in Ontario, the traditional territories of the Haudenosaunee Confederacy, the Wendat, the Mississaugas of the Credit, and the land that is part of the Dish with One Spoon Treaty territory. The Dish with One Spoon Treaty calls on everyone living in its boundaries to peacefully share and care for the land, water, and all its people. So to me, this means critically engaging with the colonial laws and policies that have been used to control and subjugate Indigenous people across Turtle Island. Drug policy, such as the 1908 Canadian Opioid Act, the war on drugs of the 1990s, the globalized violence of this regime of fentanyl border czars, target and disproportionately impact Indigenous and racialized people who know intimately that displacement, deportation, medical abuse, criminalization are tools of ongoing colonial and white supremacist violence. And the toxic drug supply crisis is a symptom of these settler colonial states that rely on the disposability of some to prop up the power of few. So in my belief, we don't need more police, prisons, or border control to address the toxic drug supply crisis. We need equitable access to healthcare, to housing, to life, and to dignity. And honoring life, as the Dish with One Spoon Treaty instructs, means creating the conditions where it can flourish. And it means honoring the dead and fighting like hell for the living, as harm reduction, disability advocates, and union organizers remind us. So words matter, we all know this, but I do just want to take a few seconds to talk about the language I use, because I think it's really important to be accurate in this moment, to name the actual problem and to combat stigma that creeps into our conversations about drug use. So I use the language of toxic drug supply instead of opioid crisis or opioid epidemic because it is more accurate. Opioids themselves do not result in death, but it's an unregulated drug market and lack of services to check drugs and make informed decisions about one's usage that lead to death. Accidental poisonings are predominantly caused by drug policy, not the drugs themselves. I use a language of people who use drugs because it's person-first language that recognizes that drug use is a behavior, not an inherent characteristic. Too often, people are dehumanized, criminalized, and pathologized for using drugs. However, so many of us use substances that alter our state of being, from cold medicine to antidepressants to alcohol to fentanyl. So naming it as a behavior avoids assumptions about why people use drugs or what impact that has on their lives. I say drug poisoning, though I do use the word or language of overdose because that's what a lot of folks who experience drug poisonings use. But drug poisoning emphasizes that deaths result from toxic substances in the illicit drug supply, so like fentanyl contamination, rather than users intentionally taking excessive amounts. So this shifts the language from an individual mistake to systemic issues like unregulated drug supply. And then this work is grounded in harm reduction. So I'm sure many of us know what this is, but I just want to make sure that we're clear about it, or I'm clear about it. Harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on the belief and respect for the rights of people who use drugs. And I'm going to be talking about supervised consumption sites. So up until about 6 months ago, we had 33 supervised consumption sites in Canada. They are very quickly being shut down. But a supervised consumption site is a legally sanctioned facility where people can consume pre-obtained drugs under the supervision of trained staff. They provide sterile equipment, monitor for drug poisonings, offer immediate medical intervention, and also connect clients to healthcare, treatment should they want it, social services, and community. This is an image of an SCS in Toronto. Okay, so in 2025, there were over 6,000 reported opioid toxicity deaths in Canada, meaning 16 people died every day. And in that same year, over 75,000 people in the US died from a drug poisoning. Alarmingly, 1 in 3 Americans know someone who's died due to an overdose. These deaths are preventable. They are the result of the criminalization of drugs and the people who use them. Experts have long told us that prohibition and punishment do not deter drug use. Prohibition creates stigma, exacerbates the conditions for illicit and unregulated drug markets, amplifies extreme poverty and homelessness, and increases the spread of preventable illness and disease. Despite this evidence, we are in a moment of intensified violence against people who use drugs. The Trump administration has launched a full-scale attack on harm reduction, cutting life-saving healthcare and research, further criminalizing poverty, all while funding a drug war abroad. And in Canada, provinces are shutting down supervised consumption sites, introducing involuntary treatment, and clearing encampments based on suspected drug use, arresting people who refuse to leave their homes. These measures worsen public health crises by making it harder for social service workers to meet their clients where they're at, forcing people to use drugs in dangerous and isolated conditions, and further exposing people living precariously to police violence and incarceration. So in the fall of 2024, library workers for supervised consumption sites formed to leverage our position as library workers and organize against the closures of supervised consumption sites. So this was a group of 10 library workers across the province who got together to talk about the impacts, not only on us, but not only on our communities, but it became clear that we also needed to talk about how these closures and the toxic drug supply crisis was impacting us as frontline community workers. So as Noah Lenstra said in the first session yesterday, quoting Maureen Hartman of the St. Paul Public Library, libraries, and I would add vitally, like frontline workers, are so often left out of community conversations that deeply impact us at the library. So we knew that library workers' voices needed to be heard as our governments made decisions that impact us, defunding vital health services and concentrating more resources in library spaces. So we expanded our scope. We began to research, document, and share the impact of the crisis on our patrons, our communities, and importantly, us and our work conditions. So over the last 2 years, we've written open letters to the government, held regular meetings, presented at CUPE Ontario Library Workers Caucus meetings, held sessions at the Ontario Library Association Super Conference, facilitated classes at the University of Toronto LIST program, made deputations at library boards, met with library leaders, given interviews, published articles, collaborated on zines, a lot more. And in our conversations with colleagues across the province, it became very clear that the lack of resources, chronic understaffing, absence of meaningful training and support has meant that library workers don't have the tools that we need to respond to drug poisonings in our libraries. Every day, library workers witness how our governments abandon our most vulnerable patrons, resulting in library workers responding to more complex medical and social emergencies on the job. Between 2022 and 2023, there was a 529% increase in suspected drug poisonings at the Toronto Public Library. And in 2024, there were more than 100 reported drug poisonings in TPL branches, including multiple deaths. And this is a highly underreported number. So in the summer of 2025, Ontario Library Workers for Supervised Consumption Sites conducted a survey of 133 library workers across the province, revealing that 38% of us had responded to a drug poisoning at work. So while libraries offer bathrooms, good lighting, comfortable furniture, caring staff, they are not supervised or safe consumption sites. Drug use at the library means unsupervised, non-sterile conditions for people who use drugs and expose patrons and staff, including minimum wage cleaners and maintenance workers, to sharps and biohazardous materials. Public library bathrooms in particular present a real challenge for frontline library workers who are trying to balance protecting the right to publicly accessible bathrooms and personal privacy with safety concerns around patrons experiencing a poisoning in a bathroom stall. And I just want to be clear, I believe, and this group believes, that increased drug use and drug poisoning at the library is a symptom of governmental policies that target poor and racialized people. As library workers can attest, people are hurting, and the tension is boiling over in all kinds of ways in the public library, especially in a huge urban center like Toronto. Many of our patrons are angry and frustrated with the limited ability of the library to address gaps in social and health services. Other patrons are upset that they're confronted by a growing class divide and public health emergency when studying, attending a story time, or picking up their holds. And all different variations of this anger are regularly directed at frontline library workers trying to do the best with what we got. And it's important, the library is rightly celebrated as a third space, a place where everyone is welcome as they are for free. This is what I love most about the library. This is like absolutely worth fighting for. However, it is also a core tension in public library service. Competing needs and limited resources strain our ability to be everything for everyone all at once. And that said, library workers are accountable to our patrons, and who gets listened to is very much shaped by power. So complaint-driven conduct rules tend to amplify the loudest voices, which at least in Toronto, to be honest, are the whitest and the wealthiest. So in practice, this means that visible drug use or intoxication can get you banned. And increasingly, it means having the police called on you. These codes of conduct end up disciplining people who need the library the most, trading their access for other people's comfort. And library workers, just like our patrons, have conflicting ideas about how to address the complex harm of these intersecting crises in our spaces, especially the toxic drug supply crisis. In our conversations with library workers, and I think we've probably spoken to about 400 of them in the last 2 years, competing desires emerged. Some library workers want stricter rules, more security, and the expulsion of people who use drugs. Others, like myself, want a more compassionate harm reduction approach to people who use drugs in the library. However, one thing across all of our conversations is abundantly clear. Frontline library workers in urban centers like Toronto do not have what we need to respond to this crisis. Too many of us know the stress of trying to keep someone alive while simultaneously being responsible for library operations and staff. I once described to a fellow worker the absurdity of having a patron approach me for printer help while I was responding to drug poisoning, and their response was, "Dude, same." This shared experience is symptomatic of the chronic understaffing of Canadian public libraries, which is not uncommon, where it's not uncommon for one staff member to be responsible for multiple functions of a busy branch, or sometimes be working alone. While proper training is necessary to help staff feel confident when responding to complex medical emergencies, library workers actually cite understaffing and workload as the primary barriers. We continue to hear that management has not taken the toxic drug supply crisis seriously, nor workers' demands for safe, reasonable, and fairly compensated work. Often the training that we did get was short, asynchronous online modules, or support was minimal, outsourced mental health programs like EAP that really were inadequate given what library workers are up against. So, however, as we sought to engage employers, unions, and library workers about all of this, as a group, we stayed really grounded in our refusal to let our right to a safe, supportive, fairly compensated workplace be weaponized against our patrons who use drugs. Our belief is that our desires are intertwined, and we all benefit from social systems that serve the diverse needs of workers and patrons alike. And this really requires us to think about safety and how we talk about safety in our libraries. So what do we mean by safety, and for whom do we prioritize it? And we really need to deal with our own feelings of discomfort and fear and reject the belief that our safety is in tension with that of our patrons. So a drug poisoning is a medical emergency, though often scary for the responder. The person experiencing a drug poisoning is at risk of serious brain damage or death. This is a real safety concern. And I feel it's so important to continue to ground ourselves in the fact that the most profound impact of the toxic drug supply crisis is death. So conversations about safety, for example, must include conversations about what it means to invite police into the library, especially to respond to someone in crisis when their mere existence is criminalized. It requires us to ask questions about what happens when people no longer have access to safe places to rest or to access community. But we also need to consider the damage done to library workers' emotional and psychic well-being when we not only witness legislated harm done to people we care about, but are unable to provide compassionate and competent care due to understaffing and punitive library policies and government policies. So instead of the language of health and safety deepening antagonisms with our patrons, it can be a source of working class solidarity. Our desires for safety and respect are in fact what our patrons also desire. Library management and our elected officials have a lot of work to do. And as library workers, we need to hold their feet to the fire. So library workers, especially those who are unionized, are uniquely positioned to raise questions about health and safety in the library without pitting workers against patrons and without relying on narratives of punishment and control. As a part of the larger labor movement, library workers must continue to challenge structures that pit working class people against each other and recognize that a system that relies on the disposability of some hurts all of us. And so I'm going to pass it over to my colleagues now who are thinking about this in the American context, and I think are grounding it in some really incredible stats. And if there's time at the end, we're going to come back to a bit of what it might look like to deal with this bleak reality. Okay, I'm going to pass it off to you, Zane.
So I'm going to share my screen here. You guys see it? It's shown on the screen, right? Okay, great. Okay, thank you. So, when opposition to opioid-related harm reduction services arise from communities and library staff, I believe it can be easy to place blame on patrons who are experiencing opioid use disorder. However, in my part of the presentation, I will focus on the patron side and especially how people with this opioid use disorder experience public libraries and library staff based on the survey data we collected. So Margaret and I, we collected 317 survey responses from the people with the opioid use disorder in the region with the highest opioid poisoning death rate in the United States. So building on the previous discussion of library worker safety, I want to show that patrons affected by this kind of opioid crisis are not only a source of concern or risk within the library spaces, they are also community members who use the library, seek information, and in many cases, experience the library as a trusted and supportive environment. So, using our survey data from the OUD population, I will highlight 3 points. First, how frequently and how these patrons use the library. Second, whether they feel comfortable asking librarians for health, recovery, or housing information. And lastly, how stigma shapes their information-seeking experiences. So these findings help us think about libraries as spaces where worker safety and patron safety can be supported at the same time. I just start with this framing. Staff safety matters because libraries may be asked to respond to overdose, navigate policy uncertainty, and manage emotional labor without enough support. However, at the same time, patron safety also matters because people who use drugs often face stigma, unstable housing, health information needs, and barriers to care. These are not separate or opposing issues. They point to shared conditions, safety, dignity, access to information, and community support. So this framing gives us a way to connect the staff side of the presentation with the patron side. Okay, so the first empirical point is that OUD patrons are already using the library. In the survey, actually, this is this is not the final version of the data calculation. This is the draft version, but in the survey, about 15% of respondents report using the library every day. So if you consider the people who use it 2 or 3 times a week or a few times a month, the number would be much higher. And this is meaningful because it suggests that the public library is not a marginal space for this population. It's part of some respondents' everyday routines. So when asked what they do at the library, respondents described their activities like reading books and magazines, using the internet, getting information, and in some cases, being safe. This helps us present this OUD patrons not as a disruption to library space, but as people who are actively using the library for their information, access, and stability. The second point is that respondents, their relationships with the library staff were mostly positive. In the open-ended question about how library workers treat them, only 5 out of 317 responses mentioned negative experiences with librarians. And I also looked at the question asking whether respondents trust information provided by the librarians. Because this item was coded yes or no, I calculated the mean, and the average was 1.14, which is very close to 1. Assuming that 1 represents the more positive response, this suggests a strong level of the trust. And this matters because trust is a necessary condition for any library-based information support around health, recovery, or harm reduction. And the third point is that patrons appear relatively comfortable asking librarians for practical information. For the questions about health, recovery, and housing information, the mean scores were all close to 1. Health information was about 1.21, recovery information was also about 1.21, and housing information was about 1.18. So this suggests that many respondents may see library staff as potential information supporters or connectors. I would be careful here not to suggest that library staff should become health professionals. Instead, the finding supports the need for training, clear referral pathways, partnerships with community organizations, and policies that protect both librarians and patrons. And finally, I would bring in the stigma items. They are useful because they connect safety with information access. The survey includes enacted stigma, anticipated stigma, and internalized stigma questions. What I found interesting is that family-related stigma items showed more negative responses, while library staff-related stigma items were generally more positive. This suggests that libraries may function as less stigmatizing information environments for some patrons. I would frame this carefully. It does not mean that libraries are automatically safe or that every experience is positive, but rather it suggests that there is already a foundation of trust that can be strengthened. So, taken together, these findings suggest that the public library can play an important role as an information and support space for patrons affected by this opioid crisis. Many respondents reported using the library regularly, trusting information from librarians, and feeling relatively comfortable asking library staff about health and housing related information. And at the same time, the stigma related findings remind us that access to information is not only about whether resources exist, it's also about whether people feel safe, respected, and listened to when they seek help. So, from the patron's perspective, supporting harm reduction in libraries is not only about responding to crisis moment. It is also about creating everyday conditions where patrons can access information with dignity and where library workers may be supported through their training, clear policies, and community partnerships. So this connects directly to the larger argument of our presentation that patron safety and library worker safety should not be treated as competing priorities, but as shared goals. Thank you. And I'm gonna turn over to Margaret. Sorry.
Hi, how are you? I only have a couple of minutes here, which is fine. So I'm just going to go over some of the primary takeaways from the study that Dr. O was just discussing. And to be clear, this is a study where we did surveys with 68 library staff and 317 people who use drugs from the 50 hardest hit counties by opioid overdose rates the year prior. Okay, so we split them up into urban and rural. And there's a lot more that we went over in the study than I can possibly talk about today, and even more in the research that I did for this presentation that I'm going to talk about today. So I did put my slides in the chat. Feel free to look at them. I haven't published these results yet because I actually updated these slides on Monday after I did some analysis. But what I do want to mention, what I think will be of interest to people here, is that I had a lot of different indicators of burnout on my survey. Okay, so I specifically asked library staff, including librarians, paraprofessionals, right? I specifically asked them how they felt about how they were impacted about the opioid crisis. And I asked them everything, we asked them everything from exposure incidents, like how often are you exposed to patrons that are clearly under the influence or are a negative factor in your workplace? Stuff like that. How often have you witnessed overdoses, right? Found paraphernalia. But then I also asked them a lot of questions about like, how do you feel supported by your employer? Do you have library policies in place that are helpful to you? Things like that. And what I found and what I want to communicate to you here today, the thing that I think is most interesting right now is that the people that responded who did not feel supported, the people who did not have policies that were clear, were the ones who also reported that they had really high degrees of compassion fatigue and other factors of burnout. They were considering job or career change, right? And what I found and what really surprised me in this was that there wasn't really a relationship between exposure to people who use drugs in negative factors and burnout for library staff. The burnout tended to have much more to do with whether or not they felt prepared, protected, trained, and supported. So on this, you can look at these yourself. But again, hey, don't publish these. That's my job. There was a real gap in the information needs that were perceived by library staff and by people who use drugs. And the gap wasn't so much in terms of like what they were reporting they needed, but like there was a real shift in how they looked at things. And I think that how they looked at things mirrors, what they see libraries for, right? So interestingly, people who use drugs were really interested in using libraries for traditional ways first, right? Like they wanted books, they wanted history resources a lot, which is pretty cool. And then after that, they wanted like housing assistance and like how can we get jobs and how can we get legal help. Whereas what staff thought that they needed the most was addiction help, harm reduction help, substance abuse help. And I think that that reflects how we perceive that population versus how they perceive libraries. And I think that's a really interesting point. So I have some major points for advocacy for librarians here, but what I really, really want you to see is that this particular slide, Command Alt, Command C, bear with me, everyone. Probably, I can't do it. I can't do it. I'm sorry. If you go into the slides that I shared, this particular slide has specific points for every one of these to advocate for. And afterwards, it talks about the OCLC's fantastic steps for public libraries to advocate and has resources as well. So I just wanted to point that out to you. Please look at these, and I'd be happy to talk to anybody about them later as well. And Kendra, back to you. I think you have 1 minute.
Amazing that you said all that so quick. Please check out that toolkit. It's incredible. And I think the only thing I want to add, because I get that maybe my presentation was a bit bleak, library workers really care about, so many of us really care about what we do and want to be resourced to be able to do the kind of work that we thought we were being hired to do. So we need meaningful training and like in hands-on in-person training. We need support that looks like, I don't know, maybe a couple days off after you respond to an emergency, not a 30-minute appointment with somebody online. We need more staff and we need better compensation. And we need our work conditions to match the intensity of what we're being asked to do. We need to be able to take seriously that our job scopes are expanding. And we need robust community infrastructure because libraries can't do this alone. That's where these partnerships come in, which is incredible. We can't do it alone, and we are increasingly being asked to do that. And if you're in a unit, if people are in a union, it's a great place to start pushing some of these questions, especially through things like joint health and safety committees. Get organized with each other is what we keep telling people, and learn some stuff because I think there's a lot of investments in us being pitted against our patrons who use drugs, and that just doesn't have to be the case. So thank you, all of you, and also happy to chat with anybody afterwards.
Thank you so much, y'all. Round of applause. Thank you to Kendra Cowley, Margaret Sullivan, and Sane O for your amazing presentation. See, we've added a couple more questions to save for the end. So again, for those of you who may just be joining us, please feel free to drop questions using the Q&A feature, which we will get to after our final presentation, which is from Dr. Renate Chancellor and Christopher Stewart, who will be presenting Make Me Wanna Holla, Libraries, the Unhoused, and Mental Health Justice in Public Spaces. So I will turn it over to the two of y'all. Thank you so much.
So thank you, everyone. This has been really great to hear how the previous presentations have talked about this topic. And yeah, so it's been really great. I'm Renate Chancellor. I am Associate Professor at Syracuse University School of Information Studies. And my research really evolves around issues of social justice within LIS. And more recently, I would say recently within the last 7 years, I have focused on social work within libraries. I have currently a grant looking at different models of how social work is being handled in specific libraries. And so I publish in that area more recently. I also am developing a theory on fugitive epistemology, which I think connects very well with social work in public libraries as well, trying to understand how users who are often marginalized may need to navigate different systems in a very subversive way in order to be helped or to access information. And so I'm going to pivot to Christopher here so he can introduce himself, and then I'll come back.
There we go. Hello, everyone. Thank you, Dr. Chancellor. My name is Christopher Stewart. I am a senior school librarian in Washington, D.C., but I'm also a professor at St. John's University and Syracuse Universities in their information science studies program. And my work centers around illiteracy and decreasing poverty and houselessness. I've been active in that work for roughly 25 years. And also looking at book apartheid as it relates to spaces in different localities that and individuals who do or don't have access to literacy engagement and literary opportunities. I am so glad to be here with you all, and thank you.
Okay, so let's get into this idea of libraries and social infrastructures, because a lot of the previous speakers have spoke about how libraries are basically social institutions and they're considered community anchors. And I think it's also interesting to understand that in 2023, the Surgeon General's report said that they consider libraries as a place that that doctors should send their patients to get help with depression and other type of mental health. So I want to kind of start with that understanding, and also just kind of convey the idea that libraries are social infrastructures. And so this has been considered for as long as the public library as we know it really was developed. I would say it was developed in the early, like the first public library in the United States was developed in 1854 with the Boston Public Library. And then it kind of evolved in the 70s to be more of a user-centric, user-focused type institution. And I think when that occurred, we start looking at libraries as a place or of a structure where people can go by and get help and services. So libraries have often been the first point of contact for individuals who are experiencing some type of social challenge, such as homelessness, mental health crises, or unemployment. Um, and so they usually are places where people come to get not only just information about how to search for these issues or how to look for information to help themselves, but they also go for particular help, crises type help that can often occur. And so I think what Christopher and I are going to kind of focus on, because we're educators within this space and we both have taught like public libraries, and he's developed a social work course in public libraries, we're going to focus on the educational aspect of it for libraries. So librarians frequently perform these social service roles without the formal training, as I think has been mentioned earlier. And so what I have come to realize is that education, that early training should occur when they're working on their 2-year or their master's degree in library and information science, in which they often do not do. And so I teach a public libraries course at Syracuse, and I have since incorporated this idea of social work, because in my experience, a lot of students who enroll in the course to take public libraries or go off to work in public libraries, they're not adequately prepared. In fact, they're shocked that they have to do some of the things that they are asked to do once they're on the job. And so my focus here is how should we prepare students to support these vulnerable populations that they are encountering when they go out and into working and working in public libraries. So there's adequate data that kind of supports the fact that public libraries have increasingly encountered patrons experiencing mental health crises, homelessness, and other psychosocial needs. And so library staff frequently report feeling unprepared and lacking adequate training to respond to these needs. Emotional labor associated with public services work also contributes significantly to the stress. I think some of these points have been highlighted previously. Um, and library social work collaborations have expanded rapidly as libraries respond to growing communities, which is essential, which is what I am finding in my research as well. As I mentioned before, I'm looking at models of how specific libraries, we visited um, different libraries in Washington, D.C., um, uh, Denver, Colorado, New Jersey, Baltimore Public Library. They all have really great models for social work. It's not just these libraries, but these are good, great models. Unfortunately, I have found in the research too that one of the main reasons why libraries don't have a social work program is because they don't have funding to do so. And so even these libraries who are in communities that are in dire need, they don't have funding. So I don't think it's really so much of they don't perceive it as an important need. It's more so that they don't have the funding to do so. So I argue that social responsibility begins in the classroom. And so public libraries or people who are teaching public libraries courses are, are not really key to the fact that it is important for them to give or incorporate in the curriculum a realistic point of view as to what they're going to be doing once they leave the classroom. And so I just finished up teaching public libraries this semester, and so I have since revised the course since I've been at Syracuse to really kind of underscore this point. And so I know my students are getting in the last couple of years are getting this basic idea as to like what is expected of them. So preparing students to ethically work for work they already have done is curriculum on honesty, right? Or that they will do. I believe is if we're doing the curriculum correctly, if we're incorporating these different models that are out there, connecting our students to like do either through internships or practicum, or even just site visit as to what the actual realistic day-to-day task as a public librarian will be, I think is really important. And also debunks neutrality myths that I think are prevalent within our discipline, that the library should be a neutral space. It is neutral in the sense that everyone should be free to come into the library, but it is not neutral on how these issues, these challenges like poverty, or even those who are using um, who are under some type of a substance and they can't function well. And I think those type of things, typically librarians in the past have kind of stayed away from those type of issues and say, oh, we're just here to provide resources such as books or, and or other type of sources to help with information access and not really take on these issues that are really prevalent in the community. And so I think we are seeing the profession kind of move beyond that as of recently, but I still think overall the profession has this idea that they should remain neutral. And then an individual resilience focus, so not necessarily focus on the community, correct, but also focus on the individuals who come into the library, um, and to provide services to them specifically. I think social work librarianship is a great way to do that. The libraries that I have visited, whenever there's some type of emergency that occurs that requires a social worker that is actually in the library, it has been really great for that social worker to come in and work with the individual who is having challenges. I am particularly impressed by the San Francisco Public Library, who has this idea of peer navigators. So these are people who were once either unhoused or dealing with a challenge who have come in and they in turn work for the library to help other individuals. So not only study communities that in terms of like environmental scans, which I think is great, but I think questions should be asked about what is not visible, what we do not see. And that's connected to the idea of fugitive epistemology as well. So why this is a social responsibility issue is that by underpreparing students shifts risk to individuals. And so um, I think someone said earlier in the talk about if this is not addressed, then somehow you want to put the blame on the person who is having this medical emergency or um, dealing with opioids. So, but by unpreparing students and not giving them a real life depiction of what's going on, it actually shifts that risk to the individual. Silence reproduces burnout, anxiety, harm, and inequity as well. So again, the more we educate our students on this topic, it minimizes burnout, anxiety, harm because they actually have a, um, a strong idea of what they're getting involved into, what they're getting into. Also, they can also put in checkpoints in their understanding of what the work they're going to do. Perhaps not only just do training in school, but also at the particular library. Maybe there needs to be some type of bench, something put in place through the library, for example. If you're working with maybe this includes like taking frequent breaks or at vacation time or time away or or that open communication with your supervisor so that it can minimize the harm and the anxiety that occurs. And care is a professional value. Either we teach it or we exploit it. And so I do think that is something that the profession has more recently start putting in place about having care for the individual, not only the care for the patron who is going through challenges, but also the professional, right? The librarian who is dealing with or working with these challenges. So in my research, I have seen that there is a lot of overlap between the competencies for social workers and librarians. And so this is just an illustration of typical work for social work and then work for librarianship. And I think up until recently, there has been like, oh, librarians pretty much, I mean, information literacy. And I think basically talking about these issues on Unhoused and medical health issues, challenges, mental issues, that is an information literacy. Those are information literacy issues. And so I do see that there is an overlap in the two disciplines based on trauma-informed practice that either the social worker or the librarian may have to employ, ethics. The field are particularly library science as well as social work. They have various ethics in the field and they're very similar. They're not so far apart that you can't see that there is this overlap. Equity is always important I think at the core of both of these professions, these disciplines, there's equity or equity-minded approaches that should be taken when dealing with some of these challenges. Policy, whether it's policy that's you're implementing within your own institution, your library, they should be very much aligned. And then data literacy, use the data in order to um, help you better understand your community, but also help those in power to be able to understand maybe we need funding. If you can provide data for the issues that are dealing with, like how many patrons have come in and utilized services. That can in turn be a way to go to maybe the mayor in your city or the branch librarian to kind of speak to the fact that we need some financial support. We need funding, to offer additional services or to bring a social worker in a public library. I think someone asked a question earlier on the chat about how many libraries have social workers. And at my last check, it was under 20%, which is very low compared to what the need is. Someone else may have some other data on that, but when I checked about a year ago, it's like 20% in the United States. So what LIS education can do, which I think is important, is teach mental health literacy as information literacy. Uh, I don't know if there's too many LIS programs that are doing that, but I think it's important to normalize referral and refusal as well. So I think LIS education can incorporate in the curriculum, like when you're dealing with these challenges, that you're not dealing with them alone, right? You can actually have collaborators collaborating with the local agencies in order to help with these challenges. And also integrate trauma-informed service principles in the curriculum as well to help better prepare librarians to go out on the front lines. So integrating, I just want to talk a little bit before I kind of shift it over or pivot over to Christopher, is that when I revised my course, I started incorporate course modules such as trauma-informed practices, housing insecurity, mental health, first aid, and ethics of care into the curriculum. So students can have an opportunity to engage with these issues and these challenges. I also connect them with real life social workers as well to give them a real life opportunity to have a conversation, to understand what their role is. So I've incorporated that into the course models. I've also combined LIS readings, readings that are maybe typical in library and information science, along with social work and community health scholarship as well. My assignments that I have students analyze case studies on Unhoused um, and actually for the semester, they are responsible for case study, looking at 2 libraries for the entire 15 weeks. And they are looking at issues of the unhoused and interactions related to um, issues of mental health challenges and things such as that. So they reflect on implicit bias and empathy. So it starts with them. Like if they have their own implicit bias about who the unhoused is or who use opioids, I try to debunk that and try to have them incorporate some type of empathy for that. And also partner with local service organizations in terms so they can have like a realistic idea, understanding of what that partnership could be working in the public library. De-escalation and referral and resource navigation as well is something that I hope that they come out of the class with. And finally, students report, I have been able to, like I said, I revised the course. And so I've been able to gather just a little bit anecdotal data on how students feel about the course or how prepared they feel to go out in working in the library. And they do report to having a more realistic view on public library work. And they view public librarianship as a civic and ethical vocation. And also I have to share one of the comments that I got. I brought in um, one of the earliest social work librarianship from San Francisco Public Library in the course this semester. And when students, when we debriefed after she left, the students said, "This is exactly what I signed up for." So that was really, wonderful to hear that, they're able to see at least, get a realistic, as much of a realistic perspective as to what their role will be. So I also encourage development of cross-listed courses with social work. So it's not only am I looking, do I teach the public libraries course? There's a foundations course in library information science. I think that it should be incorporated throughout the curriculum. So it shouldn't just be one course, it should be other courses as well. And hopefully it fosters a professional ethos grounded in equity, care, and social responsibility. So now I'm going to turn it over to Christopher, who is going to share with you about a course he designed and his experience.
Thank you, Renata. Thank you, Dr. Chancellor. I wanted to acknowledge this land and its people in Maryland and Washington, D.C., which is where I'm from, where I'm born and raised, particularly in Anacostia, a part of Washington, D.C. The Noshchok Tank indigenous people are commonly referred to as the Anacostians and Piscataway people.
I don't think that the audio can be heard, Christopher.
Peace. Go. Could you all not hear that?
It seems we have a number of people who said it was either lagging or very low, so you may want to do a recap if possible, if we can't get the volume up.
Okay, thank you. So that video, basically, I'll let you all look it up. It's from Spike Lee's video, and basically, what he's saying is to wake up. In the video, he's saying to wake up. And in this particular movie, rather, which came out years and years ago by famed director producer Spike Lee, was talking more about colorism in that film. But this idea of waking up and making me want to holler really gets to this idea of mental health, how we serve, and also the unhoused and those who are experiencing who are disadvantaged in some aspect, typically societal disadvantaged. So I teach a course. I created a course, Library Services for the Unhoused at St. John's University Library Program, and definitely leaning into being peaceful, loving, and also, of course, as a librarian, that's who we are. And so I teach this course in the summer. It will be its third year. It's a very popular course. It's always maxed out, and students get a lot of information from this course, a lot of resources, but also, though it is an online class, I do require students to go in, if they are able to go into these spaces and to see how libraries are providing service to those who are experiencing houselessness. So the course explores intentionally accessible and non-discriminatory curated spaces for unhoused library stakeholders, as well as being made aware of the importance of creating space for all. Case studies included. With a humanity-centered approach, students will address biases and stereotypes while learning and testing best practices and transforming how the unhoused community is best served. We begin the course by really defining houselessness and poverty in America and globally. And I go in it with more so seeking knowledge from them. So I want to know exactly how they are defining it. And then we dig in a little bit. The unhoused is defined as one's current state rather, as far as being unhoused. That's the space that I'm in at this current time. Versus being homeless is too often described as an individual. That's who I am. I am homeless. So you have some theorists and some individuals who are really pulling that apart. and I'm one of them. I choose to use Unhoused because I want to make sure that I'm respecting the personhood. Students learn from about Canada's child benefit, a tax-free monthly payment for eligible families to help with the cost of raising children under 18, as well as Finland's ability to create enriched opportunities for those who have been unhoused, really with a housing first approach, making sure even if you have some type of mental health challenge or whatever you may be experiencing, they make sure that they house you first as opposed to seeking the some type of care later. They house and then immediately care. If you're interested, but regardless of if you're interested or not, they still make sure that they house you. Unfortunately, in 2026, because they had a regional servicing change, they have seen an uptick in 2026 for unhoused individuals, but I'm sure they are working on that diligently to bring that number back down. So when we talk about this idea of equipping these global leaders with empathy tools, you know, I it's very important to me to make sure that they really understand what's at stake if they are in a community serving as a librarian or as a circulation assistant or just serving in that space, whether it's academic specialty or public library or even school, um, to make sure that they're doing a needs-based assessment and they're understanding their community, their stakeholder, and also partnering with individuals in the communities, social service agencies, and and really being a team player. So houselessness by the numbers. Point in time counts are usually done in January, and these record those who are experiencing houselessness. Houselessness increased 18% from 653,104 people during the 2023 point in time count to 771,480 people during the 2024 PIT. So we're going to see usually those numbers come out in September for 2025. So when we talk about, I love this quote by Archbishop Desmond Tutu. Hope is being able to see that there is light despite all the darkness, and there is light. Even with these challenging times or in these experiences, drug overdose and suicide. Well, actually, with these figures here, we see that over more than 9 million people rely on rental assistance to stay housed. And unfortunately, DC being one of them, Puerto Rico, Rhode Island, New York, and Mass, we see that those have the highest numbers. And we also can look to the overall changes in overall homelessness by race as well, by ethnicity. We see that, of course, when looking at, I guess, a little lower, we see that white individuals experiencing houselessness, we don't see much of a change. Hispanic Latinos, we do see quite a bit of a change. And we also see, there we go. We also see a changes for all of the multi-races as well from 2019 to 2024. So the library, it is the heartbeat of the community. Any space, any library rather. So when we talk about mental health, drug overdose and suicide remain leading causes of deaths in the U.S. These deaths, often associated with mental distress, continue to impact families and communities socially, emotionally, and economically. Sometimes mental health isn't considered a disability, unfortunately, but it is certainly a disability. Long-term houselessness among those with disabilities has risen significantly. Overly chronic in 2006 was 86,132, and in 2024, that number jumped to 167,991. Overly chronic individuals in 2016 was 77,486, and in 2024, that number increased to 152,585. Now, something that's not talked about enough that I definitely want to make sure that we were well aware of is racism and mental health. When we discuss mental health, we have to also mention something that doesn't receive, unfortunately, a lot of care. Racism packs a punch for those enduring it over a lifetime. Was a piece that WashU graduate student Isaiah Spears researched. The greater stress exposure we see in Black Americans likely has origins in societal structures that have disadvantaged Black Americans across generations, Spears, 2026. According to the National Library of Medicine, Black people were 5 times as likely to experience houselessness than white people, with Black families with children 11 times as likely. Regression results showed that Black-white disparities were positively associated with a measure of structural racism that accounted for housing, economic, education, and criminal justice inequities. So doing the work and being the work. And since 2019, I have provided housing to individuals in Washington, D.C., some who have experienced houselessness. I have typically, someone has usually come to me being referred to by social services in the community, or maybe even there's 4 quadrants: Southeast, Southwest, Northeast, and Northwest. And so usually this is in Southeast or even Northeast, but I have gotten individuals from Northwest as well. And so this is not a shelter situation. This is a home that I own that since 2019, families, I guess 7 years, families have been able to stay here. And usually it's for a 12 or 24-month period. Some have paid nothing. And others have been able, they're working, but they just can't pay, DC rental prices. So I know that there are think tanks and NGOs that are doing this exact work, regardless of funding being cut across the nation and many other countries as well, for this work. But you have librarians who are being intentional, whether at work about programming and resources, or in the community. So these are some librarians, or libraries rather, who are doing the work, right? In serving. So you have University of Nebraska Lincoln Libraries, and I included 2 academic schools because I think a lot of times we think only public. I could also talk about some of the work on which I do at my school as far as a food pantry and clothing closet. But yeah, you have academic schools that are universities that are doing the work as well as far as their libraries. So University of Nebraska Lincoln Libraries offer well-being programs. So they give house plants away, and they also offer counseling and psychological services co-hosted with the Prevent Suicide, which is beautiful. It really is awesome that they do that. Of course, you've already, Dr. Chancellor already mentioned DC Public Library. And so many other libraries, but we have a DC Public Library We Care program. The library peer specialists are at locations across the city. It's 6 to be exact. It's 26 branches in DC, and 6 of those branches, they offer emotional support, referrals for housing, ID, which is very crucial, as you all know, ID, vital documents, clothing, and other resources. In the Las Vegas Clark County Library District, they just recently, pilot program, Preventing Instability Through Live Outreach and Targeted Support. It's a collaboration with the Las Vegas Library Systems and Klein Veterans Fund. The pilot, as it's named, offers help with rapid response housing assistance, such as rent, deposit, and utility aid, along with connections to food and transportation resources. Utility bills have skyrocketed, so that's really a big thing for anyone, but definitely for veterans as well. And San Diego Public Library, Human Trafficking Awareness. They have a Human Trafficking Awareness Conference. Also, every employee in the San Diego Public Library system receives training in identifying and recognizing signs of human trafficking, along with the knowledge to take appropriate steps when they see these signs. And the University of Minnesota Libraries, De-Stress. So in 2021, university libraries at the University of Minnesota began partnering with the Boynton Health, the campus student health services, to open a new mental health clinic on the fourth floor of the library. I just love this. And it's at the university's West Bank. All can engage with therapy animals and intentional programming as well. So that's, I mean, that's like deep collaboration, right? Um, so that concludes our presentation, and we want to thank you so, so much.
Thank you so much, Christopher and Dr. Chancellor. That was absolutely incredible. Thank you to all 7 of our amazing presenters today. As a public library director myself, I feel like I have learned a great deal today, and I'm sure that everyone here has as well. We are going to move into our Q&A portion now. You may have seen that Alicia just dropped in the chat. Since we've had such amazing presentations, lots of amazing information given, we are going to be remaining for our Q&A over the initial time. We only have 10 minutes or so left for the initial time. If y'all are able to, our panelists and our audience, stay on a little longer so we can make sure all questions are answered, that would be amazing. Our next conference presentation isn't until 2 p.m. Central, so we do have a little bit of time in between. So, Alicia, please correct me if I'm wrong, but offhand, I see we have 3 open questions that I'm going to present.
And one from the chat that I'll send to you.
Yes, thank you. So I will start with our first question from Deborah Robinson. And this question was dropped during Dr. Topek-Walker's and Dr. Paauw's presentation, but I think any of our panelists can chime in here. Dr. Chancellor already did for part of this question. So what percentage of public libraries have social work librarians? And also, do you happen to know if there are similar partnerships and collaborations between schools of public health and libraries? And I'll turn it over first to Dr. Topek-Walker and Dr. Paauw, but anybody else, please feel free to chime in.
I'll say I don't know the percentage, but I do know that here at Stony Brook, our School of Public Health does have a relationship with our public libraries, and we work in collaboration on a program called Healthy Libraries program, where we have public health students and social work students and nursing students and PA assistant students that work together in public libraries to provide health-related services, social work services, equitable and up-to-date data information for people. And the public health program does a ton of research and like kind of especially like behind the scenes work in organizing and like grounding the students in understanding social determinants of health and like community needs and like how to work in public spaces. Because for a lot of our medical students, it's like a brand new experience for them to be working in a public library doing health-related services. So our public health partners are absolutely crucial and do amazing stuff, within all the collaborations.
It looks like one of the presenters who's speaking later just dropped in the chat too some info about their program there. I can speak to the first part of the question. Yeah, I think Dr. Chancellor already addressed this. So we have approximately like 60 to 70 full-time library social workers in libraries across the country, and some of them, it doesn't mean that there's 60 libraries. Some have 2 library social workers or more even. So I'd say it's approximately, probably 50 or so public libraries that have full-time library social workers. For the student libraries, and Dr. Chancellor also spoke to this too, is a lot of libraries don't have social workers but want them, but just can't afford them, right? It's like a funding issue, is a barrier for those programs. So kind of the go around for that has been having social work student internship practicum placements in public libraries, which is what Leah spoke about with her program and my program a little bit too. But that is significantly larger. That number is like 175 within any, like among any academic year. Um, a lot of those students are working by themselves, like not with a library social worker there. So that's like covering, more than just those kind of like 50 or so branches that full-time social workers are at. So yeah, just to give a, little bit more information about that. And I dropped in the chat too the whole person librarianship map. That is our attempt to keep track of all of these programs. I say attempt because there isn't really anything that's like streamlined. This is where you go for all of this stuff. Though that's something Leah and I are hoping to develop, kind of more, streamlined situation. But yeah, if you have any suggestions or anything like that for the whole person librarianship map, I'm now like the facilitator for that. And so, yeah, it's a cool map to check out too. We really span like across the whole country and try to keep it up to date as best as we can.
Thank you both. And I'm so glad that y'all mentioned the fact that some of our libraries have full-time social workers or social work departments, and some have social work students, social work interns. I'm the library director of a very small public library in the upstate of South Carolina, and we have a full-time social worker on staff, but we actually started with having a social work intern, and we're able to kind of turn that into a permanent full-time position. So that is a wonderful, almost gateway, if you will, if you want to get started. Because having our social work intern cost us nothing, and it was a really fantastic option. So thank you both for that. Someone just asked in the chat if someone could drop the link to the map again.
I'll pop it back in.
Thank you, Alicia. We have a second question that was dropped by an anonymous attendee. And I'll pose it to the whole group, all of you. Do you have any thoughts or opinions you could share about Ryan Dowd? I am dismayed by his approach and concerned about his trainings, but I know there are people who like him. So if anyone is familiar with Ryan Dowd and his trainings.
I can speak to that, and certainly others feel free to chime in too. Yeah, not like the biggest fan of Ryan Dowd over here either. So I'm trying to think. So 2019, 2020, I was a part of the library social work task force that was part of like PLA and ALA. It sunsetted like in 2022, but we were around for a couple of years, and one of our main projects for that was developing the trauma-informed framework for supporting patrons and then writing that book. So that was like really like the main, the main reason for that book was to provide something to public libraries and librarians, library staff, something like other than Ryan Dowd, because Ryan Dowd was really just like the only thing that was out there. So yeah, definitely feel free to check out Trauma-Informed Framework for Supporting Patrons. And then I wrote a follow-up book called Navigating Difficult Situations in Public Libraries that kind of like continued on with like de-escalation skills and stuff like that from a trauma-informed lens. So yeah, I can pop those in the chat too.
Thank you, Dr. Paauw. Any other thoughts from any of our other panelists? Well, thank you again, Dr. Paauw, for that information. That actually kind of ties into a question that I was going to ask when Margaret Sullivan, when you were speaking about opioid crisis training. I would love to hear from you or from any of our presenters about what kind of opioid crisis or mental health training you would recommend. I'm a mental health first aid instructor, and I can preach about mental health first aid all day long, but I would love to hear from y'all and your recommendations as well.
So the OCLC has this Fantastic. I'm putting it in the chat. Resource here. And here is me giving a pitiful YouTube presentation of it. Um, that's one tool, and they've updated it since, I believe, but you know, that gives some resources and some ideas for how to help librarians look at their local data to look to see like what the actual needs are in their communities and what that data says so they have more information. And then how to work with other partners and, local community leaders and things like that. But then also it focuses on library staff self-care. Not like take a bubble bath and drink a glass of wine, but like policies, like have a post-traumatic event stress de-stressing plan or things like that. How to, for example, support library staff who have been through a traumatic event, de-escalation, conflict de-escalation skills, things like that. So, in my research, I learned that the library staff that took my survey really want these policies, really want more training. The people who were suffering from more compassion fatigue wanted it more. It's not that they were sick of dealing with these people, it's that they wanted to know how. Okay. And I think that's really important.
Thank you so much for sharing that. Any other training or resources any of our other presenters would recommend?
I would just say talking to whatever like harm reduction organizations are in the community. So folks who do this on a regular basis. I mean, one of the problems that we encountered at TPL was that a lot of the training was provided by like first aid programs. And there was just like a not only biased and stigmatizing training, but also like incorrect information about how to respond to things. And one of the things that is true with the toxic drug supply is that it's always changing, like the actual compound of drugs that people are using, which means that the physical response to them looks different. And so people who are doing this work every day on the ground, I think are like the most useful at being able to instruct others how to do it. And so as public library workers, we were like, here's an hour, you can go sit at this computer and watch this totally disembodied presentation that actually isn't relevant to your community at all. Whereas having people actually come in and sit with us and answer questions is just so much more meaningful.
Thank you, Kendra. And Margaret Sullivan just dropped in the chat, reach out to your local public health department and ask them for a list of local harm reduction organizations or AI. When in doubt, AI. Any other thought? Christopher, I saw you just unmuted.
Yeah, I would also, I think for PDs, so we've all gone to a professional development opportunity that just wasn't it. And I think, I think really inviting the community into these spaces. So maybe clinics and rehabilitation organizations to come in and actually do a talk. That goes into that collaboration piece again and really using the resources all around um, as to, make sure that staff not only understand, but also can, if they aren't already empathetic, can gain that empathy.
So well said. Yes. I love you saying we've all been to professional development that just isn't it, but I think we can all say that this was it. So very appreciative for all of y'all. We do have another question that was dropped earlier in the chat from Sand Garrison. It was aimed for Dr. Paauw and Dr. Topek-Walker. I have been tasked with creating the library social work program in a public library system. Are there any current frameworks or standards of practice that you know of that would be good to review? And I know several of you mentioned several amazing ones throughout your presentation. So if y'all would just kind of want to re-highlight some current frameworks or standards of practice.
Go
I
for
think
it, Leah.
muted at the same time.
We're going to say the same thing anyways, likely. So go ahead.
I was going to say, so I think we mentioned it before, but Dr. Beth Waller has developed some phenomenal resources that are free and like super digestible and easy to apply. And so I can look it up and drop it in the chat
I
or
got it.
you. Sometimes Margaret Ann and I just share our brain. So, but those I think are amazing for starting any program. They give a ton of guidance. And I'm trying to think. I know also like we're accessible. Like we've spoken to, email, like I'll speak for myself, email me, call me. We definitely chat with lots of folks about starting programs. As a person who started a program with a director that said, I think you should just do a thing. Having other people to talk to and, get some ideas from is crucial. So I'm always happy to chat about starting programs.
Leah and I have also kind of dedicated our research kind of careers and trajectories to creating standards of practice for library social work. As someone who is a library social worker, 2019, 2021, something like that, within 2018, within those ranges, there was like not even research, not much research anyways, and so we've come a little bit of a way since then, but not enough, right? And so like a lot of these programs are like starting up and then, starting from scratch when you don't have to. We have like we know, we have an idea about what we're doing. There's just not like it's not all centralized in one area. So something Leah and I have been doing is just figuring out how to centralize all of these resources, but then also we're looking at developing a guidebook for best practices. So TBD on that. Hopefully we've found a publisher in NASW Press, but TBD.
That's so exciting. I definitely want a copy when that is published. That's
Awesome.
fantastic. Thank you both for that info. And I selfishly have a follow-up question myself when we're talking about starting programs. So, like I said, I'm a public library director. We have a social work program. Um, but I've been surprised hearing from some of my colleagues, fellow library directors or library admin, that it's not even necessarily the lack of funding that is stopping them from starting a program. It's the fact that they do not want to start a program at all. And you hear a lot of times it's because of things like mission creep or the idea, we can't be all things to all people all the time. So I would love to hear from any of our presenters your thoughts on that, or things that we can do in public libraries to, maybe convince some of those folks that this is beneficial, not just for your communities, but for your staff as well.
I guess I can chime in here too. A couple things first on with the grant. I have an ALA grant with my doc student, and in probably around September, we're going to be publishing a toolkit for social work in library. So look out for that. So this is, we've been traveling all over to kind of see where, what's going on. So we're going to publish that. But in relation to your question, yeah, I have found that too, that some libraries feel that, oh, well, it's not so much of a priority where we are, or, we have higher priorities or more important priorities, or that is just not our lane. Because I also encounter students who are like, I didn't come to library school to do social work. I came to library school because I want to be a librarian, right? And so I had to kind of show them, well, if this is this may not, public librarianship may not be the thing for you, right? Maybe you want to do some other type of special librarianship, whatever, right? So, but most times students do come around to it when they realize that the core of our field is really, the profession is really a service profession, which is similar to like social work, librarianship. So yeah, that is a real thing. I have found, however, that most libraries that I have spoken with, like they're like, oh, we need the money, we need the funding. And then also when I think about if the Surgeon General's report is saying, oh, go to libraries, we should be getting some funding from the federal government, right? To help us, help libraries sponsor these programs. And so I guess, maybe that doesn't fully answer your question, but I do see that is a real phenomenon. And I just think that, um, in terms of communicating with the manager, I think maybe showing them data, you know, whereby they cannot, refute, it's irrefutable, right? So if we have people coming in asking for this, then we are doing a disservice um, to our community if we don't invest in this or prioritize this.
Thank you, Dr. Chancellor. I will say it personally warms my heart to know you're teaching the next generation of public librarians. That I really appreciate that framework and that perspective. So thank you so much. Any thoughts from any of our other presenters?
Yeah, again, Leah and I both unmuted at the same time and are probably going to say the same thing. Yeah, I think we've certainly noticed, or I've certainly noticed, like there's like the two kind of camps where it's like this isn't our job, and then there's the other camp that's like this is our job, we've already been doing this. So I've even had pushback on both sides where, libraries that are like we're already meeting the needs of our community and doing a lot of resource navigation anyways. What more could a social worker have to offer, right? And I think like with library social work, well, social work in general, at least my view is we're doing the best job when we're putting ourselves out of a job. So if a library doesn't need a social worker, that's fantastic, right? Like because they're able to get their needs met and their needs of the needs of the community members met, right? So yeah, but there's definitely this kind of two camps, and oftentimes that lives and exists within one library, one branch, even, right? Which can, kind of complicate things a little bit, in terms of, yeah, like the work that we're doing and how we do our work. But yeah, Leah, did you have something too?
I was just going to say we had just concluded doing a study on library social work programs that had ended. And one of the things that we found was that they didn't end primarily because of like lack of funding. It was more like this clash in vision and alignment with what is the role of the library and like, do we want to be a place where we're providing, equitable access to services, or I think, and I think that means and that's kind of a blanket statement that might mean something different to different people. And administration in different, in public libraries, they, like we're already there, right? Like it's already happening. People are coming in that need assistance. And so it's we have to decide, in what way are we going to serve them, or are we going to serve them? And I think, having a social worker on, working and doing library social work, it can help take away from the mission creep, because now the librarians don't have to do the social work. They have a social worker there to do the social work, but the library has to be in agreement that they want to do these things. And sometimes they're resistant to it. I think thinking about Kendra and Margaret and Sane's presentation, like I think a lot of the bias and and kind of the embedded belief system about the folks that we're serving, it gets in the way of really being aligned with our vision and how we want to, be and how we want to make libraries accessible. So that was just kind of my 2 cents.
No, that's a fantastic perspective. Again, thank you. Thank you all. Um, and I want to be mindful of time. So I want to thank everyone again. Thank you to all of our presenters. I know some are signing off right now. Thank you to our participants who are still here asking amazing questions, great feedback. I'd like to say that we are committed to ensuring Social Responsibility Roundtable's programs are diverse, inclusive, and free for our attendees. In order to do so, we rely on support from ALA, membership, and direct donations. You can help champion our Roundtable's mission and commitments by donating at the link that Alicia just dropped in the chat. Please help us maintain our high quality programming, core values that sustain it, and our commitment to accessibility by making a donation, becoming an SRRT member, or helping spread the word about our Roundtable and events. Our next session today is the transformation of Ukrainian public libraries into mental health hubs during war, which will start shortly at 2 p.m. Central Time. We hope that you can join us, and thank you all again to our audience and our panelists. Thank you so much.